Welcome to this episode of Nursing Edge, the Unscripted Saga conversation, where we journey through the history of nursing education using stories that connect the past to the present and then our future as we reimagine our teaching and learning. March is the birth month of Lillian Wald, born on March 10th in 1867. Lillian is remembered as having founded community health nursing. Her dream was launched through her creation of the Henry Street Settlement in New York City. The Henry Street Settlement philosophy was to serve as a national leader in service to children, families, and the poor. Lillian Wald lived at 265 Henry Street, where she was present to both serve as a nurse and educate other nurses who would be central to her mission. She recognized the powerful role of nurses and women to achieve public health reform. The settlement opened one of the earliest playgrounds to provide a safe environment for children who at the time were forced to play in crowded and unsafe city streets. She was the voice for today's school nurses. At a time when nurses worked solely in the home as private duty nurses, and children were not allowed in schools if they were unclean or were suspected of illness. Lillian Wald worked over a decade to persuade the City of New York and the Board of Education to begin a program of public nursing. Nurses were paid to be in public schools then to assess children, treat them on site, and conduct home visiting when indicated. This was revolutionary at the time. She was a voice for diversity and inclusivity, speaking out against the status quo. She was an advocate for immigrants at a time that sought to restrict the promotion of immigrant culture. She promoted women's rights and recognized how women contributed significantly to the American way of life. She helped to institute the NAACP, the United States Children's Bureau, the National Child Labor Committee, and the National Women's Trade Union League. She was a champion of access to health care and encouraged all citizens to act on their own responsibility to benefit humanity. Lillian was praised by President Franklin Roosevelt for unselfish labor to promote the happiness and well-being of others. Today, her work continues. Specific examples can be seen, for instance, in New York, where her legacy continues through the public health efforts of the Visiting Nurse Service of New York. Their tireless work in home health care services range from private nursing care to hospice and palliative care. The Visiting Nurse Service of New York, pioneer in home health care, is now the largest non-for-profit home health care agency in the nation, making over 2 million professional home visits to more than 100,000 patients each year. Lillian Wald died on September 1st, 1940. She was later elected to the Hall of Fame of Great Americans in 1965. She was inducted into the American Nurses Association Hall of Fame in 1976 and was honored by the National Women's Hall of Fame in 1993. Reflecting on her work and her life, we can make a strong connection to nursing education today and our collective efforts to prepare nurses for community nursing. Our healthcare systems are changing. Our consumers are more independent in their health and wellness practices. Chronic disease management is no longer treated in acute care settings unless the patient exhibits an acute exacerbation. And chronicity is on the rise, especially in our marginalized populations. All of these trends driving the presence of nursing in the community. In 1902, speaking at the 6th National Meeting of the Society of Superintendents of Training Schools for Nurses, which later became the National League for Nursing, Lillian Wald spoke about her shared vision for the nursing profession and for advancing nursing's community-based priorities. Quote, "The one idea I wish above all to bring out is that among the many opportunities for civic and altruistic work pressing on all sides, nurses having superior advantage in their practical training should use their talents wherever possible in reform and civic movements," unquote. Now more than ever, Lillian Wald's legacy informs nursing education and nursing practice on the importance of nurses working across the continuum of healthcare settings. Lillian Wald, pioneer, reformer, who forged a path for today's men and women in community and public health nursing. And so the saga continues today. And may our saga continue as we bring to a close this episode of Nursing Edge Unscripted, the Saga Conversation. Thank you for joining us. And remember, good teaching doesn't just happen. Find your fit, push the boundaries, and celebrate the ahas.